Hi, and welcome to CVTV. We're here with Dr. John Osborne at State of the Heart. John, great to be with you.
Thank you, Scott.
So we want to start off and just get to know you a little bit.
Okay.
Where did you grow up as a child?
So I grew up all over the place. My dad was in the Air Force, and we traveled a lot and lived many places in the United States and when I was growing up.
Did you also spend some time overseas?
Yeah, we did. For about 2.5 years, we lived overseas in Vietnam during the war. So
Whoa.
It was an interesting experience.
Yeah, exciting time to be a kid in Vietnam.
Yeah.
Huh? Well, that's great. So where did you settle down after your dad's travels?
So we settled down in Pennsylvania, in Reading, Pennsylvania, and that's ultimately where I went to college.
And tell us about your college, Penn State or University of Pennsylvania?
I went to Penn State, and my goal, I knew I wanted to go into medicine. My goal was to basically get to medical school as soon as I could, because that was where I wanted to be.
That's great. So how long were you at Penn State?
I was there a year.
You were there a year. How did that work?
Well, I knew I wanted to go to medical school, and at that point there were a few programs that allowed one to accelerate that process. And there was one program in the nation where you could do medical school and undergrad, not in 8 years, but in 5 years.
Wow.
And that was with Penn State and Jefferson Medical College in Philadelphia. So that's what I pursued.
So 1 year, got your undergrad, went to the medical school, got your MD, and then did you go on into residency, or where'd you go next?
Well, when I started medical school, I was 19, so I was substantially younger than most people there. So I felt I had some time in my hands, and I loved medicine. So what I also did while I was in medical school is also get a PhD as well in cardiovascular physiology.
In cardiovascular physiology. So staying with the theme of, so you went from a general medical school, started to narrow down on cardiology a little bit, got your PhD. Where was your next step?
And then after that, with my interest in cardiology, I wanted to go to the best place to study cardiology, and that was Brigham and Women's Hospital in Boston.
Okay, that's a Harvard-related program, is it
Yep,
not?
it's one of the Harvard affiliated programs, and that's where I did the rest of my training for the next 7 years.
7 years. So 3 years in internal medicine and 4 years in cardiology?
That's correct, including research time at Harvard Medical School.
Oh, that's neat. And that was on the health of the blood vessels, or what was that on?
General cardiology, vascular disease. My particular interest is in vascular biology, so diseases and conditions of the blood vessels.
Interesting. Okay. So you get done with that and think it's time to come to Texas? Is that where you came next?
So at that point, when I finished my training, I came down to Texas. I was recruited here. I have family here, but was also recruited to start a not-for-profit research institute, which I did, and still going strong 11 years later.
That's great. But you're no longer affiliated with that. You went out and actually, from the research institute, now you've actually become more clinical in orientation.
Right.
Is that right?
That's correct. I love science. I love research, but at the same time, I love taking care of patients. And after a couple of years, decided I really wanted to get back into clinical care and take care of patients, and that's what I did.
That's great. Now, you started State of the Heart, and tell us a little about the philosophy of State of the Heart.
So State of the Heart is really meant to incorporate the latest in our understandings of patients, frankly, of how we can best take care of patients, how the science allows us to better take care of patients, and really using the technology to understand and treat patients better than ever before.
One of the things that I find most interesting is here we are in a very technologically sophisticated culture, yet 50% of men fall over dead of heart attacks the first time they ever have a symptom, and 67% of women, the first symptom they have is chest pain, death, and they never have a chance. Do you think the way we manage this disease is going to change soon?
I certainly hope so. It's very frustrating to understand that this is a disease that historically has killed roughly 1 out of 2 Americans. Whereas I tell my patients, it's a coin toss whether you're going to die of this disease or not, 50-50. And not only that, not only is the burden of disease so high and the risk of it so high, is that when you show up with symptoms, when you know you have the condition, roughly half of those men and 2/3 of those women, their first time they know they have the disease, when your body alerts you to it, is when it kills you. And that's a major issue, a major problem. And I think that's why with new approaches, using this understanding, using some of the technology, I think we're going to really be able to eradicate heart disease in the 21st century.
Wow, that's exciting. And so State of the Heart's dedicated to making that happen?
Absolutely.
And how do you do that? So if I'm a patient, I'm thinking, do I want to go to State of the Heart versus to the cardiologist around the corner? What would make me want to come to State of the Heart?
Beyond the cappuccino bar?
You do have cappuccino
We do have a
water.
cappuccino bar,
okay.
and we try to make it a comfortable environment. That's right.
There. Got it. Okay.
But really, we have unique technology that allows us to understand in a very direct way whether you have the problem or not. Frankly, that's been the issue. Because this is a disease that starts out decades before we ever have symptoms, before we have chest pain, before we flunk our stress test. It has been ongoing for decades before that. The problem is, before you have symptoms, you really need a substantial burden of disease before it knocks and tells you, I'm here.
Huh, interesting. So it's like in a car, you go along and you've got gas, and then one day, at one moment, you no longer have gas. There may be a couple of fits and sputs before you get there, but you go and you're fine. What I hear you sharing is that with heart disease, you can go along and a lot's going on. You know, just as the tank and the gas tank's emptying, the plaque inside your arteries is building, and then one day, kaboom, it hits, and actually there was, did you say decades, 15, 20 years that we could have picked that up?
Absolutely.
But we haven't had the technology, or why haven't we done that?
We haven't had the technology to be able to identify it 10 to 20 years upstream before we end up at the point where we need balloon stents, bypass surgery, or worse yet, show up with sudden cardiac death or a fatal stroke or heart attack. But we now have that technology.
So State of the Heart is dedicated to and capable of going back, taking that 15, 20-year window and knocking it out and figuring out you've got it. And then, so that's the detection part of it. What do you do when you find that? Is it possible, is it the kind of thing that once you develop it, you got it, and it's just the way it is, kind of like once you get to be the age of 40, you're 40, dude? Or is it the kind of thing that you actually can discover it and make it go away?
What we now understand, and this is really the exciting part of the research and the science of the last 10 years, is to understand that atherosclerosis is a condition which, if you detect it early, can literally be reversed.
So you jumped into atherosclerosis there. When we talk about heart diseases, is it all atherosclerosis, or are there other parts of it?
We cardiologists take care of a whole variety of heart-related conditions, everything from atherosclerosis, or as I call it, plaque, to heart valve problems, to heart arrhythmia problems, to electrical problems. So we take care of a lot of different heart-related issues, but probably the single most important, the most common thing that we deal with is heart disease, that is plaque or atherosclerosis.
I see. So you do heart failure and arrhythmias and all those other problems at State of the Heart also, or no?
We do all that as well.
You do that as well. But in terms of what people die of, the atherosclerosis, the stroke, and heart attacks, that's why we jumped into the plaque and how we manage plaque.
That's correct.
So we've got prevention, and there are things that you can do to keep from getting the plaque, and you teach that at State of the Heart also?
Absolutely. I mean, our goal, and I tell my patients, I tell primary care doctors, my ultimate goal professionally is to put myself out of business.
Kind of like the dental profession, huh?
No question. And we can. And that's the exciting thing about the tools we have available today. The problem is getting these tools to our patients and getting discovering where they're at has always been the challenge in cardiology, but no more now that we have the tools.
So what I hear you saying is that we have the technology. Now we've got to get the people to the technology, get them married, and now we could make a heart attack something that doesn't happen nearly as frequently?
Absolutely. One of the things that, one of the terms I've coined is in oncology, in cancer medicine, we have a variety of ways of detecting disease early. Because we understand early detection is good.
Right.
We have mammograms, pap smears, colonoscopy, PSA tests, a whole variety of ways of detecting cancer early because we know that's better for our patients. It makes them live longer and better. We've never really had a good tool to detect heart disease early. All of the tools we have typically have detected heart disease late, and typically that's after people come in with chest pain, symptoms, angina, those kind of things. And that's not what, by the time they show up at my door, historically, they don't have a little disease, they've got lots of disease.
Interesting. So you are going to be able to change the paradigm through this technology that you've been able to
No question.
John, are you married?
Yes.
Do you have kids? Tell us about your family.
I've got 2 kids, been married for the last 20 years, and married my college sweetheart. and have 2 kids, and they both want to go to medicine.
Oh, that's quite an honor. And you've got brothers and sisters. You mentioned you came to Texas because you have family here.
Yep. My sister's been down here for about 25 years, and now we've been able to finally recruit my mom and my brothers, and they're living down here in Texas too.
Well, you mentioned your kids are thinking about medicine. What about the next generation back, or your brothers and sisters? Do you have other doctors or nurses in the family?
My sister's a nurse and had worked many years as an ICU nurse and recovery room nurse, but now she's actually in divinity school getting her doctorate in divinity. So she is quite a Renaissance woman.
And your mother, was she in medicine? Your father, you mentioned he ran a power plant and was involved.
My dad was an engineer, and my mom worked as a nurse.
Very good. Well, John, thank you so much for being here today and sharing your story.
My pleasure, Scott. Thank you.
And thank you for getting State of the Heart going. It sounds like such a wonderful change in the way we take care of heart disease.
It's very exciting.
How would someone who wanted to learn more about this that has access to the internet maybe?
I would encourage everybody. Our website has a lot of very useful information about us, our programs, our technology, who we are, what we're doing, and visit us at www.soth Cardiology, that stands for State of the Heart, sothcardiology.com.
Very good. sothcardiology.com.
That's correct.
Thanks. And thanks again for being here.
Thanks again, Scott.
And thank you for being with us as we got to know Dr. John Osborne in State of the Heart Cardiology.